Okay, so we've got Chris in a prone position here, which means face down. And before we actually start doing the leveraging technique to restore or relieve the disc pressure from the spinal cord, I'm going to show you what's happening here at his leg, at his thigh, or pardon me, his knee function. You'll see there's a lot of distance here between the heel and the buttock. And you're going to see that dramatically change. Now bring both feet up, Chris, and I'm going to shove a cushion under his knees. And as you've seen on the diagram, we're lifting up on his thigh, using the thigh as a lever to create disc leveraging right here. And Chris, what I want you to do is breathe deep. If you're more comfortable with your hands under your head or anywhere else there, that's fine. You can see as he breathes deep, long, slow, deep breaths, that his spine is moving here. So not only are we creating a leverage here by lifting up on his thigh, but we're also getting movement from his diaphragm. So this is passive movement. The rest of the muscles are relaxed. You're relaxed and comfortable there, Chris? Mm-hmm. Good. So, two things are happening. Movement in the discs and leveraging of the disc in the opposite direction to the disc bulging at the same time, and the discs quickly restore their position. Now I recommend 10-15 minutes of this activity, this positioning and deep breathing, night and morning. If people have conditions like sciatica, plantar fasciitis, knee pain, back pain, and so on, then I recommend more of a 15-minute period and a couple of 5-minute periods during the day. Especially if people notice the condition coming back, because most people will notice a relief from their symptom almost immediately. I'm doing this. Once again, I emphasize that people should blow out with the slow breathing, deep breathing, blow out with resistance through the lips to create back pressure in the lungs and increase the oxygen uptake. That assists every area of the body. Good, that should be long enough to get an effect. Let these down and relax. Good. Now let's just check again. Now can you see that we've cut the distance here in half? It was back here, now it'll go to here. This result, from my experience, could not be obtained if he did stretching exercises for a month. And yet we got this result in probably 3.5 minutes maybe. Good. Chris, come on up. Was that any easier coming up?
Yeah.
Did you notice a difference?
Oh, yeah.
And by the way, did you notice that it was easier to breathe in that position? You could get a deep breath?
Yeah, and I can feel it in the back and the spine.
Nice thing, good. Now you'll notice, this is the most important thing, I didn't do any treatment. What I've shown him here is what he's going to do at home because I didn't do it. Now, standing up, we'll just do it here. Pick your knee up, hold it there.
Much better. Oh, yeah.
Good, let's go back in and do the test again. Good, now we're going to recheck, Chris. Pick your knee up and hold. That's a little different. Let's just make sure both legs are great. Down and hold it out here. Don't let me push in.
Oh, yeah.
Now that is your normal strength. Bend the knee and hold it. This is not a cure. There is no trick here. There's no miraculous technique. What there is relieving the distress that was impairing his muscles from functioning. And now he's got his normal strength restored. That's it. Normal strength restored. It was available, and now he knows what to do at home to maintain it. Cool?
Yes, very cool.
Good. Thanks very much. There we go. So another complication here, when I push in here, the quadratus lumborum is quite tender. And quadratus lumborum is usually tight and tender. His abdominals, rectus hold, rectus abdominis is strong, but his transverse abdominals are quite weak. And so, we're actually going to have him put his fingers on a point on the skull that relates to the abdominals, and it's right here. He already told me that it's tender. Just put your hands on there. Around here again, hold. That's good. Come the other way. Hold. Keep it there. A couple of deep breaths. Cross again. Turn and hold. Now he has strength in his abdominals, and I go back here, dig into his quadratus lumborum, and he doesn't flinch. Critical part. Good. Well, just bring the shoulder back. Hold it there. Don't let me push forward. Well, what about that? Hold. This is the sacrospinalis muscle that runs all along the spine here, one on each side. And so if I can push him forward, it's not strong. Hold there and don't let me push back. Good. Hold there and don't let me push back. You can see the difference. He doesn't flinch at all here, but from this way, he doesn't have the strength to hold me. And of course, if you're alert, you also notice that he tends to be rounding in the shoulders a bit here. And he probably tries to pull himself back, but they don't stay back because these aren't doing their job. So we're going to simply turn these muscles. I say turn them back on. Really, I'm signaling the body to turn them back on. I go right along the sacrospinalis muscle on each side of the spine and stimulate that muscle. Now bring the shoulder back and hold. That's the immediate change in body function by telling the body to turn itself back on. Are you standing straighter?
Yeah.
Is he standing straighter? You can see it. And that we will find on upwards of 50% of the people walking around on the street today. And that's why many of them are waking up achy in the morning and have to get up after maybe just 8 hours sleep, get up and walk around to start feeling better because they're aching in bed. If that's you, this is the solution.